We're now joined by Deming Huo, professor at the National School of Development at Peking University. Professor, thank you for coming on the show. The latest is 24 are dead, and I want to ask you, you're there on the ground talking to other experts as well, and there's been a number of steps that the government has taken to try to calm the situation down, if you will, but more importantly, also solve the problem to find out what's happening. What do you see on your side there thus far?
Okay, at this moment, I think the government has done, well, stop the trading of live poultry and banning the raising of live poultry, and that has been done. I think at this moment, for instance, in the last couple of days, 2 cases appeared in Shandong province between a father and his son. So I think at this moment, the most important task is to find out whether this kind of disease is communicable among people.
I mean, that is one of the greatest fear. If it is person to person, that creates a whole nother scenario. I was in Hong Kong after SARS, obviously a very serious situation there as well. I mean, this is certainly very different at this point because it's not transmitted from human to human. But I want to ask about the economic impacts. Our reporter earlier talked about the restaurant industry and the poultry industry. And at this point, all signs point to a temporary situation, if you will, to that industry. What do you see as the economic impact thus far?
Okay. In comparison with last time between 2003 and 2004, the SARS epidemic was about, let's say, more than, about 1% of GDP. So up to this moment, the economic impact for this kind of disease is kind of light from my estimate. Of course, it's only 120 more cases, so it's unlike the nationwide spread of last time. So I would expect for the next 2 months, if that numbers confirmed has increased exponentially, then that will cause a serious threat on China's fragile economic growth.
Of course, Professor, we all certainly hope that does not happen and that we find out what the source of this disease is. Now, I want to ask you about the impact to healthcare, because even after SARS and even after the first sort of series of bird flu diseases, not just in China, but really around Asia, there was a lot of talk that the healthcare industry was going to provide vaccines, and there was a lot of preventable medicine, if you will. And I don't want to go into all the details, but it certainly does have an impact on the healthcare industry, and I just want to get your point of view on that.
Okay, yes, all the public health industry, people, they are certainly care about this. But remember, to manufacture any kind of vaccine, especially to H7 and N9, this kind of very devastating genes or viruses, it takes a long time. Well, it's not been, you could not manufacture it within 7 days. So I would say all kinds of vaccines would have to wait, but certainly know what the channels that have been transmitted is the most important things to investigate as now.
I want to ask you also about not just the healthcare industry, but also the tourism industry as well. You hinted at it earlier. Obviously, if this disease gets worse, it will affect the tourism industry. I'm going to assume it hasn't yet to this point, correct?
This is Labor Day, May 1st, the holiday. I sort of see that on the street. People have less people. I think most people are concerned about this disease, although for most people, they probably will not change their travel plan. But if a tourist, if you're coming from abroad to China, that will be affected.
All right. Professor Deming Huo, professor at the National School of Development at Peking University, thank you very much. We will be watching developments very closely along with you.